I'm interested in this afternoon in looking at some of the sort of medicine reconciliation sort of themes that are coming along. So I think that's a big issue for the future for us, along with patient e-health and how we interact with patients in the future.
It's been good so far. It's very ensuring that so many people are doing similar things to we're doing, that it's progressing, so it's been very encouraging. I'm looking forward to what's happening in the rest of the world in telehealth and how we can move it forward and a bit more integration between things.
My name's Andrew Turner, I come from NHS Dumfries and Galloway. I'm actually quite pleased because I'm a member of the committee organising the event, and I'm pleased to see so many people here. There's a good mix of people, and we seem to have had quite a lot of success in attracting people to the event. I think there probably are more people here this year. Maybe the fact that we're in the centre of Edinburgh this year instead of out on the Science Park in Glasgow, as we were last year, maybe helps. I think the open source in NHS is an interesting topic to explore. There's a number of challenges there, but that should be quite interesting.
We demonstrate the telehealth system, Bosch telehealth system. This is a device that enables patients to be monitored at home for the self-management, to empower them through the time, stabilize their condition. It's good also for the clinicians to have the ability to work more efficient and to have the patient's data available every day online. We are very happy and delighted to be here. It's excellent. The public, everybody is excellent.
Thank you very much. Thank you.
Ecom Scotland, we are pioneers in online e-learning and e-assessment, and that's why we're here today. Yeah, so far there's been a lot of interest, especially in the webcasting side of things, which is always interesting.
From Sky Diabetes Collaboration, which is Scotland's national IT system. From my personal perspective, I'm interested in the sort of patient aspects of things. I did a presentation this morning on My Diabetes My Way, which is the national diabetes patient information website. So I'm interested in hearing more about similar projects.
I'm from the University of Edinburgh.
Ah, right. And what's your particular interest in this conference?
So I'm interested in software engineering aspects, and I'm particularly interested in how you can mitigate some of the problems that come with scaling up from a small-scale research type deployment of telehealth systems up to large-scale countrywide rollout. I'm interested in many different things, but yes, I certainly enjoyed the e-health presentation this morning, and I'm mostly in the mHealth and telehealth strands.
I work for NHS 24. Well, I've really enjoyed going to the e-prescribing talk downstairs earlier today, and having a look at these people whose name I can't remember, but they're very innovative in terms of video conferencing remote sites, because we have newly opened remote sites in NHS 24 up in Orkney, Shetland and Western Isles. So we've had some challenges around training doing video conferencing, so they've gone into how it can be done much more cheaply and simpler, so I've taken lots of information from them.
We're EMIS, a primary care system. And at the moment we're rolling out across Scotland, replacing GPAS. Today we've got EMIS BCS on this screen. This is the system that practices are using in Scotland. Over here we've got our touchscreen arrival system, and at the end there's some EMIS Web on there, and that's our next product. They are coming round and they're asking lots of questions, so it has been a very useful, positive exhibition today.
Thanks a lot, Fiona. Thank you.
We're at First Data Bank. We provide the electronic drug reference database. So we're professionals in that what we do is we resource all the information that's published about drugs, and we put that into an electronic database, and then we build into that clinical decision support, so that when our data is used within a clinical system, it will link across to the patient information, such as what medications they're taking, what sensitivities they have, and what age, etc., and weight they are, and then it will provide alerts so that anybody that's prescribing a drug will get feedback information and be able to make a safe prescription for that particular patient. Very good, actually. It's been very busy. I'm really pleased that we've come and we've made a presence here. We're fairly well known in Scotland. We've been working with NSS Scotland for several years now. Our data is used within the GPAS system, so in primary care it's a fundamental part of the decision support process, and we're keen to see that being driven out to secondary care and the acute sector now.
Well, I've been involved in health IT in Scotland for a long time, and it's a good conference to come to catch up with people.
We're here to talk about our core technology in Scotland. We are part of the PMS project in Scotland, so we have a product called TrackCare, which is delivering electronic patient records with patient administration, and it's integrated using Ensemble. So we're here just to talk a bit more about TrackCare, because lots of the boards have gone live with the PAS, so they're kind of here and we can have a chat to them and then tell them about the integration part of our product called Ensemble. So we're just here to show our face, have a chat to the people that are already using our technology and some people that don't actually already know what the technology can do. It's been really good actually. We came to this event last year, but it coincided with an event we were running ourselves, so we didn't have enough people really here to make the most of it. So it's been my first one here and it's been really good. It's a really good atmosphere and people are happy to chat and interacting, and it seems like a really good agenda and people seem really enthusiastic, which is always great from a conference, because sometimes you come and people don't say anything at all. So it's been good so far.
The company is Kenos. We're based in Belfast in Northern Ireland and also in London, and also have offices in Gdansk. We're here today to launch our Evolve clinician-focused EDM solution into the Scottish market. As you can see behind me here, we have a number of customers currently all based in England. And in addition to the customers you see here, we're also onboarding 4 additional trusts, which will become customers of ours over the next 3 to 6 months. So the Evolve solution has been developed in conjunction with Ipswich NHS, with clinicians in Ipswich, and the business case really is around removing legacy patient paper records from the hospital and also introducing techniques into hospitals to allow them to become paperless over time, and then ultimately to introduce workflows and data forms to make hospitals run more efficiently and improve patient outcomes within the trust. To date, the knowledge we have around the NHS is based in England. All our customers are currently in England, and today is about coming up to Scotland to understand where Scotland is in the process and hopefully to understand how Evolve may help the similar problems in the Scottish market. So I'm sure you would appreciate it's a very short distance to get across from Belfast. So Scotland in general is a very favourable market for us. We work very well with our councils here, and this is about really understanding what we can do around healthcare. We've had very good attendance around breakfast time and then again at the coffee break, and very good throughput during over lunch as well. So very good conversations with other suppliers and also with trusts from both the IMT perspective and some clinicians as well. So very interesting.
In Restart Consulting is an integration services provider. We're a primary partner of these guys over here, InterSystems, who have the Ensemble integration engine, and we're being responsible for the implementation and the support services around this integration rollout. In addition to that, we have a clinical portal solution which we've developed in partnership with Leeds Teaching Hospital in England. We've taken that decision collectively to roll this out as an open source solution, which is causing quite a stir in the marketplace, I'm pleased to report. I say this chap here to my right, who you now can't see, is doing a lot of the implementation work. He's actually based up here in Scotland, up in the north. So we have a dedicated team here, as well as a dedicated managed service ensemble team, which is based down in the south of England as well, and whereby we're supporting these sites remotely, as well as putting chaps on site as well. Everyone that's been here has come here for a reason. They know exactly what they're coming for, what they want to see, and we've managed to tick off quite a few of our objectives so far this morning in rubbing shoulders and speaking to the health boards that we want to be speaking to, that we can't reach in any other way. So it's been so far excellent for us.
My name is Gordon Shaw. I'm a director of Capita Health, and we're here today just to hopefully to demonstrate Capita's capability to deliver solutions in partnership with the Health Service in Scotland. We're here really to if you like, showcase our work with NHS Scotland in delivering screening programmes, and the wider capability of Capita in delivering things such as work with our partners in England around website development and presentation of NHS resources. Right. So, for example, we run NHS Choices on behalf of NHS England, which we think is a successful partnership between ourselves and the wider NHS. It's been very busy. We've had a lot of interest. a lot of people coming from different aspects of health informatics, which has been quite interesting. From e-health leads through to, I suppose, more folk involved in the academic parts of e-health. So it's been a fairly wide selection of folk coming on our stand, but it's been very encouraging so far.
We are Concha, we are web and mobile applications developers, and we're really at the conference just to speak to stakeholders around the skills that we have and the products that we've developed to date. We do a lot of work with the NHS in Scotland. Around 90% of our business comes from NHS Scotland, so really here to speak to the community around anything, new technologies, what they're looking to do with on board, their strategies, see if there's anything that we can do to fit in with that.
You saw the system this morning while Michelle Caldwell was talking about it. This is the system that is installed at Ayr and Arran. We've been doing electronic prescribing now for the last 10 to 15 years and probably have the largest implementation base of electronic prescribing systems in the UK. We've got somewhere now close on to about 30 clients. We're doing a range of prescribing from full inpatient to outpatient to just discharge. We're here today really to promote the system across Scotland and look at some of the other sites in Scotland that have expressed an interest in it. And it's been quite well received, and people have been around with a lot of interest on the actual software as well. I think it's been very good. Certainly the profile of the seminars that they're doing have been very good. So we've got a lot of people here who are very interested and very keen. And it's interesting that this is more a computer, an IT literate background rather than a pharmacy or health or clinically led. But there's still a lot of interest in the actual software of the systems.
What the focus of all of this is about is reducing the turnaround time to produce a document. So we focus in on reducing errors in the first place and speeding up the whole process of getting the document to where it should be, in other words, the GPs in the community.
Right.
And that's what we're about. We exhibited last year in Glasgow at the exhibition centre, so that was successful for us too. Right. We're the national framework supplier for the NHS for Scotland anyway, for digital dictation and speech recognition. So it's nice to meet everybody we've been working with as well.
I'm Leslie, I'm here with Vodafone. So we do a lot of work with NHS Scotland as well as various health boards around the UK and around the world. What we've got that we've been speaking to people about is the range of technology, but it's not technology for technology's sake, it's about where it can help. So we've got everything from a digital pen and paper, which looks like a normal pen and paper, but when you fill it in real time, it can send everything straight back to the head office so that you've got everything electronic and recorded. Right the way through some of the tablets and the clever applications that are on them, just to make people's lives easier, to make them more efficient, more effective, to do things faster. There's a lot of talking about new ways of working, and it's the technology that helps enable some of those. So we've had some really interesting conversations. Well, there's certainly been a lot of coffee flowing, and I think that helps.
So we're from O2 Health. We're here demonstrating some efficiencies that can be saved, particular in regards to the Western Isles Health Board, where we've put a telehealth collaboration tool in place. And what this allows to happen is that clinicians to give more time back to care. So for the Western Isles, due to the fact that they have such a length of distance to travel between islands, and the challenges of the weather. Basically what we've put in is a video conferencing tool that allows you to share patient records and look at x-rays and scans, and the patients love it, but actually it means that should there be weather disruption, then you can carry on with your kind of clinics as per usual. Great, we've had some great leads, we're delighted with it, lots of interest in it about the Western Isles, so yeah, it's been a great day for us.
John Wilson from Video. We have designed an innovative product which enables video communication over any device, and when I mean any device, I mean exactly any device. Here we've got a room system, a laptop, another sort of PC, another PC here, Android Galaxy. You can also do it with the iPhone, HTC, everything like that. So kind of opens up potential within health to communicate with anybody, whether that be telemedicine, telehealth and telecare, regardless of the location. So it opens up possibilities to people in remote locations, like up north in the Highlands, Stornoway, to work over general purpose IP networks, like standard ADSL connections. Now this uses innovative software technology which enables high definition conferencing, very immersive natural experience over standard ADSL networks. And you can see from this just now we're bringing in loads of different kind of devices from all over Europe through high definition, whereas before standard video conferencing technology was limited by its quality. It had pixelation, it had latency, and we're talking about the big players that are in there just now. Video is an innovative new technology which has been deployed worldwide by health organisations, predominantly within private. There has been and there is trials running just now within NHS trusts down south which are working to such great success, something that they've probably not experienced in the past because they've worked on ISDN networks or very dedicated internet connections. This one here, as I said, general purpose IP networks. If you would ask me about a year ago, do I like video conferencing, I'd say no, because it's robotic. You sit in front of a screen and you speak to a pixelated person with a lot of delay, and you have to wait for about a second, 2 seconds for them to respond. If that was my experience, I wouldn't use it again. Since deploying this across my country, across my company, throughout the country, we meet more over video conferencing than we do in person. I've become more of a recluse now recently. I don't tend to leave my house or my office in Edinburgh. We generally just have about 12 to 15 meetings every day over video conferencing. It's actually easier and more immersive to do it that way than actually to pick up the phone and call them, because there's less delay on this than there is on a phone. It's been great, it has been great, but as I said before, with it being innovative new technology, there's a lot of risk involved with that. You know, people think it's brand new, has it been deployed here, has it been deployed here? And this is the constant battle that we have, is trying to encourage people that this is technology of the future. This is the way that things will be moving forward, and this is to replace meetings within healthcare, within the corporate sector, and within generally any industry.